Good evening. Welcome to the public awareness program. I'm Dr. Raju, senior consultant in gastrointestinal general surgery and minimal access surgery, Banagata Road, Fortis Hospital, Banagata Road, Bangalore. Today I'll be speaking gallstone disease and its complications and its management. Coming to the gallbladder, a gallbladder is a small, pear-shaped structure situated under the liver on right side of the upper abdomen. The capacity of the gallbladder is about 25 to 30 cc, where it helps in storing a small amount of bile and it provides the concentrated bile when the need is, like after taking food or overnight fasting. When we have breakfast in the morning, the small amount of concentrated bile is produced. It provides concentrated bile to the digestive system, and whereas the bile is produced in the liver around 500 to 600 ml per day, and which is delivered to the intestinal tract through small tubes called bile ducts. This gallbladder is connected to the bile duct, and whenever during between the meal or fasting, during fasting, the small amount of bile which is stored in the gallbladder and will get concentrated, and it provides whenever it is necessary. So coming to the gallstones, they are nothing but small pebble-like structures which are formed inside the gallbladder. There are various types. Mainly, there are three categories of stones, namely the cholesterol stone and a mixed type, which is very common. And very rarely we do come across what is called as pigment stones. The exact cause is really not known, but these stones are formed. There are multiple factors which are involved in forming the stones. The main factor which is contributing for formation of gallstones are a lithogenic bile or what is called as saturated bile. These are all mainly the chemical composition of the bile which is produced in the liver, and when it is saturated, that contains more of a saturated bile, they are more prone to develop stones. At the same time, the gallbladder which is malfunctioning, the contractility of the gallbladder is not very effective to empty the gallbladder completely, or stasis of bile in the gallbladder. Simple example, during pregnancy, because of progesterone, the gallbladder function is affected, the contractility will be reduced, there will be some amount of stasis of bile in the gallbladder. So this can lead to formation of stones. The composition of stones are made of cholesterol and bile salts, bile pigments, and some phosphates and calcium phosphates. So these stones usually vary in size, starting as small as a small sand grain to as big as a golf ball. The majority of the gallstones or people having gallstones will not have any symptoms. They are accidentally found or the detected during investigations when they do an ultrasound scan as a routine, either due for a health check or due to some other conditions. When they go for an ultrasound scan, most of these gallstones are detected, and which are primarily the symptoms are they're asymptomatic. So coming to other risk factors or causes of gallstone disease. So usually it is commonly seen in obese person. It's more common in females compared to the males, especially during childbearing age group. And after the age of 40, the incidence gradually increases. As I earlier mentioned, the pregnancy or multiple pregnancy is one of the other risk factor. Consumption of alcohol, fatty meal, or very unhealthy diet, and lack of exercise, and family history, and certain medications. People who are taking some medications probably because of high cholesterol, like cholesterol reducing medications, or some weight reduction medications, also can lead to stone formations, including certain antibiotics also. And previous history of surgeries, for example, when part of the intestines, it may be a small intestine, when removed due to various other medical conditions, or surgeries on stomach or weight reduction surgeries, or any other cause for a sudden loss of weight, or when during crash diet, where patient lose rapidly the body weight rapidly. That is also one of the cause for stone formation. And as I mentioned, various other gastrointestinal surgeries, when the stomach or other gastrointestinal tract is modified or altered due to various other conditions, this can lead to stone formation. Coming to the symptoms of gallstones, as I earlier mentioned, the incidence of gallstone disease is about 10 to 15% of the population, whereas it's one of the common surgical emergencies in the world. And only very few patients, that's a small percentage of patients who will develop symptoms related to gallstones, even though the majority will have about, the nearly 80% of them may not have any symptoms. So a very small number of patients, like about 10 to 15% of the patients will develop symptoms. In that 10 to 15%, where about 5 10% of them may require surgery. So the mild symptoms like dyspepsia, what we call it as flatulence or upper abdomen discomfort, and abdomen discomfort, fullness, and belching, and flatulence. These are the few common symptoms, or something related to acid peptic disease, or majority will be treated for acidity or gastritis. And apart from this, whenever there is acute infection, it can lead to sudden onset of severe pain in the mid upper abdomen, which can radiate to the back, especially between the shoulder blades or on the right side of the below the shoulder blade. So this is typically it's called as biliary colic, and this is usually we've seen this symptoms. It can vary, last for about few minutes to few hours, and commonly seen with stone when gets impacted in the neck of the gallbladder. And this can repeat very often. The frequency also can increase, and if not treated, it can lead to what is called as acute calculus cholecystitis. That's nothing but infection of the gallbladder. And the other symptoms, when there is infection, it can cause associated with fever, vomiting, and when there is obstruction, the stone which enters the bile duct and blocking the bile duct can produce jaundice, what is called as surgical jaundice or obstructive jaundice. So other symptoms, as I mentioned, when there is obstruction to the bile duct, the stasis of bile duct, I mean bile in the ducts or blocking the bile ducts, can lead to cholangitis or infection or inflammation of the biliary tree or bile ducts. So this is called cholangitis. These conditions again may require multiple procedures. One is to remove the gallbladder, the other one is to remove the stone from the bile duct. The coming to the diagnosis, the any suspected gallstone disease uh, symptoms like what I mentioned earlier, the dyspepsia is the commonest symptom, or mild discomfort in the upper abdomen, or a bloating of the abdomen, and especially it triggers after a heavy fatty meal. And the pain, sudden onset of severe pain in the center of the upper abdomen, that is called biliary colic, which can radiate to the back. These are suspected cases of biliary colic. Can go for it's immediately they have to consult a surgeon. And as I earlier mentioned, it is one of the commonest surgical emergencies in the world. So always better to seek advice from the surgeon. So better to consult a surgeon who deals with the gallbladder surgery, and as well the associated complications, gallstone associated complications. So the clinical diagnosis, and to confirm the clinical diagnosis, we can go for an ultrasound scan. It is a very simple test. A simple ultrasound scan will detect gallstone and its other related problems. And if we suspect any other condition associated with gallstone, or when there is a doubt, we can always go for CT scan of the abdomen. All these investigations are complementary to each other. And in certain cases where we suspect obstruction to the bile flow, that is when there is obstructive jaundice, we can go for an MRI based on a certain blood test. When we do a liver function test and CBC, that's a total blood count or WBC count. So all this will indicate when there is a rise in the WBC count, that means it indicates an acute episode of gallstone disease. And when there is altered the liver functions, increase in bilirubin values or alkaline phosphatase, other parameters suggest directly or indirectly there is obstruction to the bile flow. In these cases, whenever we suspect to confirm the diagnosis, we can go for an MRI scan. That's called a MRCP, or endoscopic ultrasound scan. This will confirm the diagnosis, whether there is obstruction or simple cholecystitis. Depending on that, so we can plan further treatment. So coming to differential diagnosis, when these things are absent in case when we do an ultrasound scan, if we could not confirm the diagnosis of acute calculus cholecystitis, the other conditions, some of the serious medical conditions which may mimic gallstone disease is the myocardial infarction or heart-related diseases. Similarly, the peptic ulcer, or sometimes even appendicitis or infection of the kidney called pyelonephritis. These are the few conditions, including some of the lung infections that pleurisy or pneumonia also sometimes can mimic, including hepatitis infection of the liver. So all this can mimic similar to the gallstone disease or acute calculus cholecystitis. We have to rule out whenever there is suspicious. In these cases, we have to involve the concerned specialist along with not only doing investigations related to the cardiac related, of course, the ECG and other investigation like echocardiogram and opinion from a cardiologist. Similarly, doing an upper GI endoscopy to rule out any stomach related, ulcer related problems. So that will confirm the diagnosis. So once we make a diagnosis of gallstone disease, then we have to rule out is there any other associated complications related to the gallstones, and then we have to plan appropriately. So coming to the complications related to the gallstones, a simple presence of gallstones in the gallbladder itself will predispose for infection. Either patient majority, as I earlier mentioned, the majority of the patients are asymptomatic, will not have any symptoms. Nearly more than 80% of them will not have any symptoms. Very few patients, or small percentage of patients, who develop certain symptoms, especially when they develop biliary colic. Biliary colic, as I mentioned earlier, a sudden onset of severe pain in the center of the upper abdomen, and sometimes with or without radiation to the back of the you know chest, or in just below the right shoulder blade. So when there is biliary colic, it's a warning sign. Always we should consider this is a warning sign. Must seek advice from a surgeon and undergo the investigations, appropriate investigations to be done for him. And then we have to plan for the treatment. So apart from this, straightforward, the complications which I was mentioning, so the stone which is impacted in the neck of the gallbladder can lead to what is called as mucocele, and when it is delayed can lead to a pyocele, and even it can worsen when the treatment, appropriate treatment, is not given, can lead to empyema gallbladder. All of them are surgical emergencies. The commonest, most common uh, problem which may arise from the gallstone is acute calculus cholecystitis, which is of course very common, and diagnosis also can be easily made with simple ultrasound scan and a blood test. And other complications when the stone is pushed into the bile duct, which can obstruct the bile flow, and this can lead to obstructive jaundice. And this is something where patient requires another procedure, added procedure for us. One is to remove the stone, and the other one is to remove the gallbladder. Whereas in the lower portion of the bile duct, which is the narrowest portion in the biliary tree, the block in the lowest portion of the bile duct can cause a reflux of bile into the pancreas, and it can lead to what is called as biliary pancreatitis. This is something serious problem. Depending on the situation or seriousness or severity of the pancreatitis, it may be a mild to moderate, or sometimes can lead to a sudden onset of severe necrotizing pancreatitis, which is something serious complication. So the other complications related to gallstones, which are of course like Meniere's syndrome, or when the stone which slips into the duct, large stones, can erode the wall of the bile ducts or gallbladder, and can create a communication with the surrounding structures called fistulas. And also this entering into the GI tract or gastrointestinal tract can lead to the gallstone ileus or obstruction to the intestine also. So apart from this and obstruction to the bile duct, as I earlier mentioned, the other complication like cholangitis, and can lead to sepsis, and if it is not treated early, can go for multiple organ dysfunction syndrome, and this can lead to even death of patient. Some of them are a life-threatening complication, as I mentioned, the pancreatitis and cholangitis, sepsis, and these conditions. Especially the chances of these, like gangrene of the gallbladder or perforation of the gallbladder, are common with associated with other uh, medical conditions where patient is having comorbidities like diabetes and other medical conditions. So coming to the treatment of gallbladder, the best treatment for gallstone disease anywhere in the world is always surgery, the removing the gallbladder. There's a myth, the majority, of course, there's the commonly asked question is, why can't we remove just a stone? See, here we are dealing with a diseased gallbladder, not just a simple stone. So that removing the gallbladder is our aim, and removing the gallbladder is the treatment for gallstone disease. And as I earlier mentioned, there are various methods can be used, non-surgical methods and surgical. When it comes to the treatment, there are two types of treatment: the surgical and non-surgical. And most effective, as I told, always it's a surgical treatment. And surgical treatment, what we normally do is removing the gallbladder. That's called a cholecystectomy, and this can be done through laparoscopy. Laparoscopic surgery is nothing but a keyhole surgery where instead of cut opening the abdomen, we create a small holes and put a hollow tubes in through about 5 millimeter or 10 millimeter holes. And through these hollow tubes, we put a telescope to visualize the structures inside the abdomen cavity. And using other small 5 millimeter ports, we use hand instruments to perform the surgery by dissection and clipping, dividing, and removing the gallbladder, and then you know put this into a small endo bag uh, and remove the gallbladder along with the stones. And coming to the non-surgical, non-surgical is not recommended routinely. When there is obstruction to the bile stone, as I told, either we can remove the stone from the bile duct by surgical method, either laparoscopically or open surgical method, or by doing the ERCP. There's an endoscopic procedure if the facilities are available. So, removing the stone from the gallbladder, there are very rarely there is an indication where we can use some medication to reduce the size of the stone or to dissolve the stone. This is not routinely recommended in all patients. Very selected where patient is having because as these medications are effective only against purely cholesterol stones, whereas the pure cholesterol stones, the chance of the percentage of pure presence of pure cholesterol stone is very very small. Only about few patients out of about 10 to 15% of the total number of gallstone disease are having pure cholesterol stones. And if the stone is very small, maybe one or two. So then it can affect, and it's going to be a long term therapy. It may be 6 months or 1 year. After once we stop the medication, still the chance of coming back is very high. The stone again reforms in the gallbladder. And this is going to have a temporary where a patient is having or not fit for any surgery. Maybe we can try this method, or those who are not willing to undergo this surgery. During this waiting period or when patient is on medication, still they have a chance of having all these complications which I have mentioned earlier. And very rarely we even consider doing an ESWL, extracorporeal lithotripsy. That's of course again, as I mentioned earlier, the indication for all this are very very rare and very small numbers, and the facilities if not available for surgical and other methods. The similarly, there is a role for laser in case when the ERCP or removing the stone through endoscopically it fails. We can use another method to avoid the surgery, complex surgery. We can still, if the facility is available, we can consider using a spyglass. Of course, it is very rarely indicated or required procedure when very difficult stone in the bile duct, which is either impacted or not able to remove through routine ERCP or endoscopic procedure, then we can take a help of spyglass using a a laser. We can blast these stones. The facilities for these kind of facilities, are available in very few limited places or in hospitals, and also the indication is very very minimal. So there are few commonly asked questions. Once we remove the gallbladder, are we going to, we have to restrict our diet? Yes, there is absolutely no need for, restricting their diet. They can absolutely get back to their normal, usual diet, and including consumption of fat also. And removing the gallbladder, fortunately, will not, affect the digestive system. So fortunately, we can live without gallbladder. So removing gallbladder will not alter, or they need not undergo any change in their lifestyle or food habits. They can get back to their routine activities and lifestyle and with a normal diet. And again, the commonly asked question is, can't we remove just one the stones and leave the gallbladder behind? So I have not mentioned one rare and uh, small number of patients. Uh, this gallbladder, presence of gallstones in the gallbladder can cause some microscopic changes or produce low-grade inflammation, which may be asymptomatic. When there is low-grade inflammation, majority will have chronic cholecystitis even without any symptoms. When it prolongs, so like for example, having these kind of stones for decades can produce chronic inflammation can transform into malignancy. So that's nothing but a gallbladder cancer. So the always it's better when we diagnose, and it's better to get rid of this. As I mentioned earlier, still we are fortunate enough to live without a gallbladder. It's always better to get rid of this when we diagnose, and especially in a symptomatic patient. And management of asymptomatic patients, always it is not an emergency. We can always advise them, those who are not accessible to the routine in case of emergency, if they are staying in a very remote places. Either they are traveling abroad where it is difficult for them to get a medical facilities, or patients who are elderly having other multiple medical conditions. And when suddenly, for example, after angioplasty or for the various heart conditions, or when they're put on anticoagulants or other blood thinning medications, we may have to stop these medications before surgery for a couple of days. And it is maybe it's very difficult or becomes a very high risk to consider doing surgery immediately in case of emergencies. In those patients, we can always plan and withhold the medications, prepare them for surgery, and we get enough time for them to uh, uh, do the surgeries safely. Whereas in case patients, like in some patients, we may have to do the gallbladder surgery as a prophylaxis in case a patient who are undergoing major surgeries or any other organ transplantations where they will be put on uh, uh, the other medications to reduce the uh, mm, immunity. I mean, they're prone to develop infections. And these patients, always they're recommended to get rid of the gallstones, or I mean the gallbladder, before they undergo other elective planned surgeries like transplantation, for example, renal transplantation and other organ transplantations. So there are a few indications in asymptomatic. That means patient who are not having any symptoms, but they have gallbladder and there's stones in the gallbladder, or there is risk of always they can develop the acute gallbladder, or it can become a surgical emergency any moment. These things nobody can predict when they're going to have, and who is going to have the infections. At the same time, the other complications which I mentioned earlier, the gallstone related complications, who is going to have. So it is always better considered when these patients can go for a prophylactic gallbladder surgery. The other asymptomatic patients who are young and very small, the stones, and always they can wait, and they have to decide on their own if they want. If they come under these categories, they can always decide whether they want to get rid of this, or they can wait and immediately they can reach a hospital in case of emergencies. So, as I mentioned, only thing, the without any alarm, like as I mentioned earlier, there'll be a warning sign. If the biliary colic is a warning sign, where we need to just undergo investigations after consulting a surgeon, and will be confirmed, and then we can plan for surgery. Whereas certain patients, before they get into any of these problems, suddenly they may land up with what is called as biliary pancreatitis. This is something serious problem, and as I mentioned earlier, the incidence is very less compared to other complications, and especially going for severe pancreatitis is very, very rare. And these patients are one which nobody can predict. And, early intervention is always better, which we can prevent further complications like increased mortality and morbidity. To conclude, adopting the prevention is the best way of avoiding other complications related to the gallstone. To prevent adoption of a healthy diet and adequate exercise will reduce the incidence of gallstones. At the same time, early diagnosis and timely intervention will reduce the complications related to the gallstones. Thank you. So, is there any questions? I'm happy to take any questions from the audience. Yeah, there's a question. Do all gallstones need treatment? As I mentioned, we divide them into symptomatic and asymptomatic. In asymptomatic gallstone disease, as I mentioned earlier, patients who come under high risk, for example, having other medical conditions where we need to plan well in advance and are undergoing any major surgeries, those patients require as prophylactic cholecystectomy, and other patients, set of patients can wait and watch. And irrespective of the size, when it comes to the size, see, size is not a matter. Like the size of the gallstone or the number doesn't matter. Even a small stone, single stone can cause life-threatening complication, whereas a large stone or multiple hundreds of stone in the gallbladder may not produce. So these things nobody can predict, irrespective of the size and the number of gallbladder. The complications which I mentioned, anybody can have. Usually, the smaller the stone, chance of other complications getting into the bile duct is very high, and including the pancreatitis. The reduction of size will not change, or the risk of all the complications which I mentioned earlier is going to be same. And reduction, as I mentioned, there are other the stones dissolving medications which are available. As I mentioned, only it is effective against very few type of stone. That's a pure cholesterol stone. Other stones, it is not going to help. Whether it is a Ayurveda, and must have seen a lot of ads and advertisements. And as I mentioned earlier, the treatment for gallstone disease is always surgery. It is not just removing the stone, it is removing the gallbladder, because we have to get rid of the gallbladder. The just reducing the size of stone may not help, and even because it is effective only about a few small number of patients who can get benefited by reducing the size, but other complications which cannot be prevented by just reducing the size of the stone. And there's one more question. If there are multiple stones in gallbladder and these were not activated and there is no problem in 3, 4 decades and these are only diagnosed, then it is okay, or surgical intervention is safe remedy for a 60-year. So as I again mentioned earlier, it is the same thing. It's asymptomatic gallstone. We can always wait and watch. And if they're having other comorbidities, then depending on that, we have to consider doing surgery. We need to prepare them and take. If they're able to reach an hospital in case of an emergency, and if they're uh, the facilities are available, then they can wait and watch. So found sometimes oily and sticky fluid at my anus door. This is something not related to gallstone disease. It probably either some inflammation in the anorectal region, or maybe associated with fistula, or sometimes even hemorrhoids. So these may be the other conditions which are probably related to anorectal region. We can we just remove the stones and leave the gallbladder alone? This question I already answered, and this is one of the common question asked by many of the patients. And as I mentioned earlier, the treatment for gallstones is always removing of the gallbladder. It's just removing stones will not solve the problem. What are the digestive health problems caused by gallbladder removal? As I mentioned earlier, again, it's the same thing. So, fortunately, we can live without gallbladder. Will not change. There won't be any major changes in the digestive system, and still the bile produced in the liver will reach the intestine as long as the bile tubes or ducts are patent. And very few patients temporarily can develop a frequency of stool or a diarrhea during immediate post-operative period. Otherwise, they're going to have a normal lifestyle and food habits. Can I leave my gallstones untreated? Yes, you can, as long as it is not causing any symptoms, and you can always wait and watch. Can I try native medicine? So definitely, this we have no definitive study where we can consider, as I mentioned, even English medicine, or it may be Ayurveda or homeopathy. Very few certain type of stones which are effective, and these medications can be effective against these pure cholesterol stone, which may dissolve over a period of time. The treatment is going to be the duration is a very prolonged period. It may be 6 months or 1 year, maybe more. The moment we stop the medication, again, chance of forming stones are very, very high. And during this medication, or when we are taking the medications, always they are prone to develop any of these complications which I've mentioned earlier, the gallstone disease and its related complications. And the one more thing repeatedly I mentioned, the treatment, the best treatment for gallstone disease is always removing the gallbladder. Why are some people unhappy about gallstone surgery? See, if it is a simple gallbladder removal, for example, if it is a simple cholecystectomy, if they come early, usually they'll end up with a simple surgery. And if there is a delay, or when they try other medications or treated elsewhere or by other specialists, or maybe the diagnosis was delayed, uh, can lead to more complex surgeries or other complications. When they have other complications, as I mentioned, pancreatitis or bile duct uh, obstruction, so they require multiple surgeries and more complex surgeries. In those situations, definitely they will be unhappy. Or when there is a gangrene of the gallbladder or perforation of the gallbladder, these are all complex, involves complex surgeries. And when we are treating, they are also, of course, life-saving surgeries. When they're on medication for try to postpone or avoid surgery and land up with such complications, the simple surgery becomes a more complex surgery. That's why probably they're not happy. Or complications related to the surgery, when these are complex surgeries, when uh, we are doing a delayed surgery where patient is already diagnosed with gallstone disease and its complications, but due to various reasons, if when they postpone, it produces a lot of adhesions and chance of injury or other complications related to surgeries are very high. So to avoid that, early intervention or diagnosis and timely intervention is always recommended. To seek a surgeon's opinion before they consider any other alternative methods. What are the post-care treatment after gallstone surgery? The post-care is, except initial few days, there's nothing much to follow. There is no medication, or it's going to be a normal lifestyle and normal diet. No other medications required after surgery. How can we avoid building a gallstone in future? See, once we remove the gallbladder, there is no, uh, the stones cannot form again. Once the gallbladder is not there, and stone cannot form in the gallbladder. So, by adopting a healthy lifestyle and avoiding a fatty meal and adequate exercise, and consuming more of high fiber, low calorie diet, adequate exercise, so can prevent or avoid forming the stones, and especially some of the medications which they are taking earlier for various reasons, and certain medications can be avoided, like weight reduction, and also to reduce their weight. So these are the main things which we can avoid, or at least postpone the stone formation. The main reason for development of gallstone, the main reason, as I mentioned earlier, of course, the obesity, alcohol, and unhealthy diet with the lack of exercise, along with the various other which we cannot prevent. It's even a family history or genetic, or patients having lithogenic bile. It's a chemical composition of the bile which is produced in the liver, and when it is saturated bile, again chances are very high, which cannot be prevented. Similarly, others, some surgeries, when they undergo certain gastrointestinal surgeries, we remove the gallbladder prophylactically, because chance of developing stones in those surgeries are high. So during that, when we consider doing certain major surgery, like removing that part of the small intestine or stomach surgeries, we remove the gallstone also. So the main other causes, like as I mentioned earlier, pregnancies, and which is very common in females because of the progesterone hormone, which and also uh, the certain medications, as I mentioned, the cholesterol lowering, or used in weight reduction, and some of the antibiotics. So even statins, cholesterol reducing tablet, can they're known to produce gallstones in some people who are having these medications for a prolonged period. And these things, some of the medications which we may not be, in a position to stop those medications, but at least adopting a healthy diet and adequate exercise, the gallstones can be, to some extent, avoided or prevented. Questions, we can end the program. And thank you very much.